In Chapter 7, we are going to discuss shock. There are a lot of things that can happen when a person goes into shock, and knowing how to react quickly is important because shock can turn badly if it's not treated. So, when we think about shock, we have to think about perfusion, which is adequate blood and oxygen that gets to all of the cells in the body. When there's hypoperfusion, meaning there's not enough blood circulation, the cardiovascular system eventually fails. When the brain does not get enough oxygen and blood, within 4 to 6 minutes there can be damage. Abdominal organs get damaged in about 45 to 90, and skin and muscle cells in about 3 to 6 hours. So there's something called the perfusion triangle. Think of the circulatory system as having 3 components: the heart, which is the pump, the blood vessels, which is the pipes, and the blood, which is the fluid. So the heart pumps the fluid through the pipes, and that's all the 3 parts of the triangle. Shock occurs when one or more of those parts are not working properly. So if the pump functioning of the heart is not there because of damage, then it can't move enough blood through the body. If the blood vessels dilate all at one time, then the normal amount of blood volume is not enough. And then if there's some type of blood loss or fluid loss, then the volume goes down. And again, these are all things that affect the perfusion or getting blood and oxygen to all the cells of the body. So what are some causes of shock? There's failure with the pump. That's called cardiogenic shock. There's a cardiovascular issue, could be a heart attack, and there's a hypovolemic shock or hemorrhagic shock, which means it's a lot of fluid or blood loss. That could be trauma to the vessels or the tissues, lots of vomiting, bleeding, etc. that could occur that cause that. There's also poor vessel function, which can be caused by an infection or some drug overdoses from narcotics, spinal cord injuries, and even anaphylaxis, which is an allergic reaction that can cause issues. If there's poor vessel function, you can also have what's called neurogenic shock, and a combined vessel and content failure will equal septic shock, which is very dangerous. So what causes shock? There are other types of causes other than cardiovascular. There are respiratory insufficiency, there's anaphylactic shock. So with respiratory insufficiency, it could be from a chest injury, but it could be because the airway is blocked. Anaphylactic shock is an allergic reaction that usually occurs to certain types of medications or food or an insect sting, depending on the person. For example, my husband is allergic to bees. He has to carry an EpiPen, which is a shot of epinephrine or adrenaline, if he gets stung by a bee, because he can go into anaphylactic shock. And those signs and symptoms that I would look out for as I look at his skin. Do I see any hives or flushing or swelling, or is it turning a different color around his lips and mouth, like becoming cyanotic, meaning it's turning blue because he's not getting enough oxygen? I check his pulse, and I check to see if he feels dizzy or faint. And also I look to see whether or not he's sneezing, if there's tightness in his chest, if he's having a hard time breathing or wheezing, or if there's any type of stoppage of breathing altogether. Then I know that he's in serious trouble. So other types of non-cardiovascular shock are psychogenic shock. That's where people are fainting or have syncope. Sometimes they just develop such a huge fear because maybe they've heard some bad news, or they've seen something horrible that just put them into this psychogenic shock where they could faint. There's a progression of shock. First it's compensated shock, then it becomes decompensated, then it becomes irreversible. So with compensated shock, you look for agitation, anxiety, feeling like something bad's about to happen. Maybe they have some type of altered mental status. They have a weak or rapid pulse, clammy skin, shallow breathing, maybe rapid breathing, some types of shortness of breath or nausea. And decompensated shock, they're really starting to have a difficult time breathing. Their skin starts changing color. It may look gray or blue, and their eyes are dull, and their eye pupils might be dilated. So these are things that if you don't get immediate help, it is progressing to the worst type or the irreversible shock. So that's it for part 1 of chapter 7. We'll continue more on shock in part 2.